Good evening and a very warm welcome to all of you in this evening live interactive session of ours where we generally try to discuss quality Ayurveda with you, and we take your questions, and we always try to take some important topics with you. The topics which are for the benefit of many people around the world. And today, one such topic is lupus. As is evident from the face which is behind my screen, you can see a butterfly wing shaped rash on the face around the nose. That is something which is the most common sign of a patient who is suffering from systemic lupus erythematosus, a disease which affects multiple organs of the body, a disease the name of which might be uncommon, but it really brings an agony to the lives of those who are suffering from this lupus. So what exactly is lupus, what happens in lupus, and why this lupus develops, and at the end, what Ayurveda can do for a patient suffering from lupus. We'll be discussing these points. So let's start from the first point, which is what is systemic lupus erythematosus? The immune system, as we all know, fights with the infections, the bacteria and other kinds of pathogens that come from outside in our bodies. And an autoimmune disease like systemic lupus erythematosus, it occurs when the immune system confuses its own body cells as foreign ones and then starts attacking the same. So there are many autoimmune diseases, and a major one of those is systemic lupus erythematosus. So let's proceed towards the symptoms of SLE. What exactly is SLE? So the common signs are fatigue. The patient will feel fatigue. There will be fever, or there can be general malaise. If the fever is not there, there will be joints pain, stiffness, swelling. The stiffness is more in the morning. There is butterfly shaped rash on the face that covers the cheeks and bridge of the nose, and there can be rashes at elsewhere inside the body also. Skin lesions that appear or worsen with exposure to sun. These are some of the common signs. Coming to the further advanced signs, there are some other signs also, some other symptoms also. I'll be coming to the next ones. And the next ones are fingers and toes that turn white or blue when exposed to cold or during stressful periods. So the microcirculation is deranged in a patient suffering from SLE. That is why, especially in cold, the fingers and the toes, they will turn blue. There will be shortness of breath. There can be chest pain. Dry eyes is one another important symptom, and there can be headaches. There can be confusions, which is known as delirium also. So there are so many symptoms, so many problems which a person can face when the person is suffering from a disease as risky as SLE. In allopathy, for SLE, till date, if I say there is no major treatment that is available, let's see the signs of lupus. When we talk about the various body parts where this signs comes: fever, fatigue, chest pain, achy joints, butterfly shaped rash on face, mouth ulcers can be there, kidney disease. Now why we are discussing this lupus especially before our live session, which generally contains too many people asking questions about their kidneys, that one of the major problems which people face suffering from lupus is lupus nephritis, a disease where the nephrons, they get inflamed due to lupus. Then there is weight gain or weight loss, and there are other skin rashes also. Along with this, it can be swollen ankles that develop in a patient who is suffering from systemic lupus erythematosus. So coming further, now what exactly are the causes of systemic lupus erythematosus? Now that we know that it is a major disease, and there are so many complications that arise in a patient suffering from lupus or SLE, we would like to have some further details that as far as allopathy is concerned, why the SLE develops. Now, as far as the allopathy is concerned, it tells that lupus is an autoimmune disease, and it occurs when the immune system attacks healthy tissues in our body. It's likely that lupus results from a combination of genes as well as the environment. Sunlight, exposure to sun, may bring lupus skin lesions or trigger the internal response in susceptible people. Infections. If the person is having infection, any critical or dangerous infection, an attack of lupus may precipitate in a patient who is prone to having lupus. Coming further, there are other causes also which can cause lupus erythematosus, and when we talk about those causes, a very major cause is the medications. When we talk about medications, yes, there are certain medications which can cause precipitation of lupus erythematosus. Like, if we go for the details, so I like to tell you that lupus can be triggered by certain type of blood pressure medications, anti-seizure medications, antibiotics. People who have drug-induced lupus usually get better when they stop taking the medication. But in some patients, although rare, the symptoms may persist lifelong. Now, what are the risk factors of lupus? If we talk about the probability that where the chances of lupus are more, lupus is more common in women, and although it affects people of all ages, it is more often diagnosed between the ages of 15 and 45. It is more common in African Americans and Asian Americans. So that is the instance of lupus, and talking about such a disease which has so much of profound problems, so much of impact on patients who are suffering from it. I'd also like to tell the complications of lupus. What exactly happens, what kind of complications lupus can cause inside the body. So when we talk about certain complications of lupus, lupus can cause a lot many complications, and the first one which we are going to discuss is kidneys. Inflammation is something which is caused by lupus, and it is very common for lupus to cause inflammation. Lupus can cause serious kidney damage, and as I just discussed, lupus nephritis is very common cause of kidney damage in patients. There can be brain and central nervous system problems too. If the brain is affected by lupus, you may experience headache, dizziness, behavior changes can be there, vision problem can be there, even strokes or seizures can be there. Many people with lupus, they experience memory problem, and they also experience problems in expressing their thoughts. So these are the complications which lupus causes on kidneys and brain. But it also causes problems in blood and blood vessels, because lupus may lead to blood problems, including a reduced number of healthy blood cells. That is, anemia can develop in a person due to lupus. The platelet counts can decrease, as a result of which bleeding and bleeding can be there. Blood clotting will be less. Inflammation of blood vessels can be there. In lungs also, inflammation can be there. It can be painful breathing. There can be bleeding into the lungs. Pneumonitis can develop in heart. Lupus can cause inflammation of heart muscle, the arteries, the heart membrane. So many problems by this single disease which is known as lupus. That is systemic lupus erythematosus. The only treatment till date for a lupus patient in allopathy is taking corticosteroids, because once they know that the immune system has attacked any particular kind of body organ, the only thing which can be done in allopathy, since they don't know the reason, the underlying reason is not clear as yet, the only treatment available is administration of corticosteroids like prednisolone, methylprednisolone, deflazacort. Such kind of medications and some immunosuppressants can be given, and they do give recovery. The good thing is that even when a lupus patient is taking allopathic medication, although temporarily, the patient does see signs of recovery. But unluckily, the medications which are given in allopathy to a lupus patient, those medications can have serious complications in patients. As a result, prolonged usage of medications of lupus in themselves can cause so much of trouble that it is always advisable to choose Ayurveda as a pathy of choice, as a pathy which can give a very quick recovery in lupus and at the same time does not cause any side effect. The only thing is, the Ayurvedic treatment needs to be concept based, and it needs to be taken under the guidelines of an Ayurvedic expert who has given treatment to many lupus patients. There should not be any kind of trials on the body. And when we talk about lupus and the Ayurvedic aspect of lupus, I would like to say that Ayurveda believes that it's lupus is a amaj vyadhi. Ayurveda says that jatra naram durbalyad vipak vastu yorasai sam sangiko dehe sarv dosh prakop. Due to the weakness of digestive fire in our body, the part of our food which is semi-digested, not digested properly, and is absorbed through the villi and microvilli in that semi-digested form, and then enters the bloodstream and starts circulating throughout the body. That can cause systemic lupus erythematosus. In the part of the body where this arm will do sthan sanchray, where it will settle, will be the part which will show signs when a person is suffering from lupus. So if with the help of Ayurveda we want to reverse lupus, people do ask me that do we need to take Ayurveda lifelong for lupus? I always tell them that see, Ayurveda has given many ways to remove arm from the body. The arm can be removed with a number of methods under a trained physician, both with the Shaman Chikitsa as well as with the Shodhan Chikitsa, and specifically with the Shodhan Chikitsa. So if a person is suffering from lupus and associated complication, which can be for any organ, those can be reversed, those can be treated very successfully with the help of Ayurveda. The first kind of medications that are required over there are Jatragni Vardhak medications. The medications which can improve the metabolic fire and the digestive fire of the body so that further arm is not developed. That is the first step of treatment. The second step over here then is Sroto Shodhak or medications. Now that we know that we are not allowing fresh arm to be developed, it becomes important that the ama which is already accumulated inside the body, it needs to be removed. The micro channels which are occluded with ama need to be purified, and that is done with the help of Sroto Shodhak Aushadhis. There are many Sroto Shodhak Aushadhis in Ayurveda. We need to choose which is the perfect for a particular person depending upon the disease condition, depending upon his body type. The third step now is complete Shodhan. In Ayurveda, there are procedures mentioned under Panch Karma, which includes Purva Karma, Pradhan Karma, Paschat Karmas. When all those are done, the occluded arm in the micro channels, whenever the arm may be there inside the body, the ama cannot escape from a good and a perfect session of Shodhan Chikitsa. So when all these three are combined and the treatment is given to the patient, which we have been doing for many patients now since many years and around the globe, the patients of lupus nephritis, they get recovery by reduction in the protein leakage that is occurring. The creatinine, the urea, it comes down. The morning stiffness, which is the most agonizing thing in such patients, that is corrected very quickly. People get a very good recovery and a very quick recovery. In the morning stiffness, all those patients who are suffering from lupus nephritis and systemic lupus erythematosus. So whatever might be the organ of your body which has been affected due to systemic lupus erythematosus, Ayurveda is always a pathy of choice and can give much recovery in all such patients. So, if you are suffering from this disease, all that is required from your end is, the number is there on your screens. You need to share your images so that we can see where exactly are the problems and any reports, any kind of treatment which you have underwent for the disease. And be rest assured, we will make sure that you come out of the disease.